you just got your braces on. We're going to give you a kit. It might look something like this, and it usually has all these items, but it might not have one or have something different, but we'll just go over everything that's in here. One of the things that's really important is this timer, especially for kids, but even for adults. If you're ever wondering how long to brush your teeth, you're supposed to brush for 2 minutes. So when all the sand's on one side and then it goes to another side, that's 2 minutes long. Another thing in here is like a little mirror. It's not that useful, but if you ever want to look at what's going on somewhere, you can use the mirror. Also, just a regular toothbrush. Now, you can use a regular toothbrush. You can also use a Sonicare or Oral-B or, electric toothbrush, anything that is good to use. But what you want to make sure of is that you're spending the 2 minutes and that you're really angling. So once you go around the braces aren't protecting your teeth from cavities, they're actually attracting plaque. So you want to angle your toothbrush, do little circles, go all around, and take your time. We do sell the Sonicare, and it comes with a special braces kit. It has 4 replacement heads that are specifically for braces. It's a great toothbrush, and it's going to have a quadrant timer to let you know when 30 seconds is done for each quadrant of your mouth. So ask us about that, and we'll tell you more. We really recommend it, and we also have something called the air floss. You're supposed to floss, but this has something where you can add water or mouthwash, and it kind of squirts air in between your teeth. It's really great for cleaning anything with food stuck. Another thing in here are these little tablets. What you want to do is brush as good as you can, then chew one, rinse, spit it out. It's okay if you swallow a little, don't worry about it, but if you see purple anywhere on your teeth, that means that there's plaque stuck. So that means you have to just pay a little bit more attention to that area and brush better. We have a travel toothbrush, which is always fun when you're doing grandma and grandpa's or sleepovers. And we have wax, and a lot of patients ask us about wax. You can get it at a drugstore. You can ask us for more. It's not something you want to just slather all over your braces as soon as you get them on, because you want to get used to your braces. But what it will do is, if anything's poking you over time, maybe your teeth just move directions, or maybe you have a hook or something that's just really rubbing up against your cheek, you can just take a little piece of wax, kind of rip it off. It doesn't have to be very big, like the size of a pencil eraser, and put it right onto the bracket or the wire. It's usually best if it's dry first, so try to blot it off with a tissue or something before you put it on. And these are floss spreaders, and what you can do with these is, it's like using a needle and a thread to floss. Now when you floss, it's going to be a lot harder. You're going to have to take your floss and you're going to have to put it underneath the wire. And you can, the best way usually is from the upper to go towards the tongue, from the lower go towards the tongue. So from the upper go down, from the lower go up. Now sometimes floss is really floppy and it's hard to get it underneath there. So if that's the case, you can use this. You're not actually going to floss with the floss spreader, but you're going to use it to put the floss around kind of the loop here. And this is stiffer, so you can get it underneath the wire easier. Once you have it underneath the wire, you're going to kind of bring it through, and then you just take one side of the floss and pull it through. If you pull the whole floss through, obviously it's back in your hands and you can't floss. But this way you can go down on each end. Now this model doesn't let us to floss, but if you go down on one side of the tooth, then you go up and then the other. And then you have to do the whole process again by looping it through, getting the floss spreader underneath the wire, and pulling the floss through. It's going to take a little longer, so we recommend try to floss at night at least. It would be great if you could floss 2 to 3 times a day. We know that you might not have time and it takes a lot more patience, so at least at nighttime when you have a little bit more time, try to floss all your teeth. As far as brushing, we recommend at least 3 times a day. We understand if you can't brush at school, but as soon as you get home from school or work, try to brush really good, obviously before you go to bed. And if you eat or drink anything after you brush, you want to brush again. So that's basically it. If you have any questions, you can let us know. And we recommend just about any type of toothpaste. Sometimes the really whitening toothpaste, it's going to be for surface stains, so that might affect your rubber bands. It's not going to get underneath your braces. So just, Colgate Total, Crest, those are typical toothpastes that work really good. All right, take care of your braces.